Let's start with news of Pfizer's success with its vaccine trial. Realistically, how soon do you think people could expect to see mass vaccinations?
Well, it's going to be a gradual process. Vaccinations will start in December, very likely sometime a bit before the Christmas holidays. You know, the thing that we've been dealing with in this country is a vaccine hesitancy, or people really being skeptical about getting vaccinated. That is pretty much overcome when you get a vaccine of such high degree of efficacy as the Pfizer vaccine, which is, 90 plus, closer to 95% efficacious. I think those types of numbers with no concerning safety signal hopefully will get many, many more people than you would have predicted get vaccinated. The other thing that's important is, as you probably know, this is not the only candidate that is being tested in the United States. There's another one very close behind, made by a company called Moderna, which is a similar to, if not identical, candidate with an mRNA. We likely will see results from them probably sometime, I would think, in the next 2 weeks or 2.5 to 3 weeks, which means you'll have two companies that will have vaccine available.
Have you had discussions yet with President-elect Biden or any of his team regarding pandemic policy under the incoming administration?
Right now, the situation, as you well know, is a rather tense situation in the United States regarding transitions. So right now, things are on hold for the time being.
What would you like to see as the immediate priorities for the Biden COVID-19 task force?
I've been talking about this now for a very long period of time, and that is an adherence essentially uniformly throughout the country of universal wearing of masks, keeping physical distance, avoiding congregate settings or crowds, particularly indoor, and trying to do things more outdoors versus indoors, washing of hands. We're going through a difficult situation, as you probably know from the media in the United States. Every day we seem to be setting another record.
How much culpability does President Trump carry for the number of American deaths?
No, I'm not going to get into any political discussions. I can absolutely guarantee you that.
Well, this might also qualify as a political discussion, but let me have a try. How have you managed your dealings with President Trump?
Well, I'm on the coronavirus task force. We had a meeting yesterday. That task force is chaired by Vice President Pence, who is in constant contact with President Trump. So there's a line of communication from the task force to the vice president, from the vice president to the president.
What's your attitude to the use of lockdowns, and when should they be undertaken?
Well, I would like that to be almost the last resort. Of course, we know there's a considerable amount of COVID-19 fatigue globally and certainly in the United States. I don't think that would be well received. I don't think you need to lock down. I think people have a misperception that when you say wear masks, avoid crowds, keep your distance, that means locking down. It doesn't. You can keep businesses opened. You can keep small and large businesses open so long as you implement certain fundamental public health practices. I think it's a misperception and misleading to think that when you practice public health measures, that means a lockdown. Australia is an example of a very successful result from a lockdown. They locked down for a period of time. They got down to 0, and now they're at a very, very good baseline, which means, getting back to your prior question, that it's much easier to identify, isolate, and contact trace when you start off with virtually no infections in your population.
How would you describe the World Health Organization's performance throughout this?
Well, it's been spotty. The World Health Organization fundamentally is a good organization, but it is imperfect. It has flaws. We know that.
What do you think are the lessons for the WHO arising from this pandemic for the next one?
Well, I think it would be to respond in a timely manner without any indication of worrying about political ramifications, and making sure the member countries, because remember, the member countries have a considerable degree of independence from central WHO in Geneva. And we need countries like China that when they get a case of a new infection to be very transparent immediately in letting the rest of the world know. We need countries like China to allow other scientists and health officials to look around and see what's going on that would be helpful. They did not allow that in the beginning. They essentially did not allow travel to Wuhan. That's not a good thing.
This is an incredible period for you to experience, and you're still in the thick of it, both in terms of managing a pandemic and dealing with Donald Trump at the same time. What has this been like for you as a human being?
Well, it's obviously been very stressful. I mean, to deny that would be to deny reality. When you have public figures like Bannon calling for your beheading, that's really kind of unusual, I think. That's not the kind of thing you think about when you're going through medical school to become a physician. But I've gotten through it by really focusing like a laser beam on exactly what my goal is. I'm a scientist and I'm a physician. My goal is to help develop vaccines. I think we've been quite successful in that. Now, the next challenge is to develop good therapeutics. And the other challenge is to get public health measures to be listened to by the American public. If you focus on that and don't get distracted by all the other noise, then it's not as bad as you might think it is. It's when you start to focus on that other junk, as I call it. It's noise. It's meaningless. You know, people calling for you to be beheaded, fired, thrown in the fire pit or whatever. That's just noise. You don't pay attention to that.
Dr. Fauci, thank you. We appreciate your time.
Good to be with you. Thank you for having me.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.